Turning now to your community focus, we've seen a sharp decline in the number of hospitalizations and COVID cases following that massive surge we saw at the start of 2022. Here to talk about the trends and more, Rhode Island Department of Health Interim Director Dr. Jim McDonald. Doctor, thanks as always for your time.
Kim, it's great to be with you. Happy Thursday.
Happy Thursday. So let's start with the data. As I mentioned, the trend certainly looks to be moving in the right direction. So is the worst of this Omicron surge now behind us?
Oh, yeah, I think so. I think I'm encouraged by the numbers. We're heading in the right direction, not just in cases, but it's the hospitalization numbers that make me much more comfortable with where we're going right now. So we're definitely moving in the right direction.
And what does this mean in terms of indoor masking and vaccine requirements for businesses? Any thoughts of dropping those requirements because of the positive trends?
You know, we're working with the team. We're talking a lot with the governor, and we're really thinking about we have to do this in a very logical manner. Like, obviously, we need to look at what is the pandemic we're facing right now. You know, so in some degree, like, can we remove some of this mitigation? And that's something we're looking at, but it's got to be done very thoughtfully. You know, it's funny, these aren't just on-off switch you can just turn off and on a little bit. But I do want to remind people that booster vaccine is really important. You know, if there's one thing I could have changed about last year, I wish we never used the word fully vaccinated, because we don't do that with any other vaccine preventable disease. It's always up to date. And this is where I really need people to think, look, if you've only had 2 doses, I need you to get that 3rd dose. We're only about 37% in that booster population. We really, you know, the governor wants us to get up to 90%. I'm wholly behind that. We need to get 90% of our population in that booster category, not to get through this, because we're going to get through this regardless, but for next fall. We've got to be, I want to stop living through this madness, so we've really got to get ready for next fall.
Yeah, you mentioned that only roughly 37% of the state has gotten the booster. It seems like we've really stagnated at that number, around 35 to 37%. Why do you think that is?
Yeah, I think part of it's just confusion on people's minds. I think people got their 2 doses and said, I'm done. And quite frankly, we're not done. And I think this really gets that larger issue of, like, what can we do here? And I think one of the things you see is more and more data coming out showing that when you get that 3rd dose, you've got much more protection, much less likely to pass away from disease, much less likely to end up in the hospital. So I think this is going to be persuasive for people. We're working with the governor to do some communications to really get some information out there, because we really want to protect our Rhode Islanders. That's why the Department of Health is here, by the way. We want to, 1, keep you healthy, and 2, protect you.
Dr. McDonald, Massachusetts health officials say the subvariant of Omicron, BA.2, is likely already in the Bay State. Any signs of it here? We
have 2 cases we just learned about this morning, so that's just 2. And you know what? It's not at all surprising. It's a little more contagious than Omicron, but quite frankly, it's not surprising. And we're just going to keep an eye on it here. And I think what people should be confident in is that, 1, we're looking for it, so I'm glad we found it, but we weren't at all surprised by it. And it's only 2 right now, but we'll see it. Obviously, we're going to get more, but I don't think it's going to change our trajectory all that much. I'm not super worried about it. I think we're on top of it.
California's governor said earlier this week he plans to release an endemic plan for COVID in the coming weeks. So a 2-part question. First off, can you explain the difference between endemic and pandemic? And secondly, does Rhode Island have any similar plans?
Yeah, so endemic, quite frankly, means the disease is permanent. We're going to live with it. And this is where the pandemic is heading for us, right? So, you know, like flu is endemic in Rhode Island. Strep throat is endemic in Rhode Island, right? And I think people should think about this almost like strep throat or the flu. Like, you know, and what an endemic plan means is, how do we make sure the usual practice of medicine, the usual healthcare system, can handle it? And yes, we're working on that. In other words, what we're going to be doing, you know, is making sure all the healthcare providers know, look, we want you to do testing in your office with those rapid tests. Every office should do specimen collection. We expect that to happen. We expect every doctor and healthcare provider to know how to prescribe oral antivirals or acquire monoclonal antibodies. In other words, it's really solidifying a lot of what we've already done, so people understand we got to live with this beast.
And so, Dr. M, just to sort of revisit something from earlier in our conversation, in terms of the masking and the vaccines, I know you said you're working on it. Any timeline? Do you think we're going to still be masking up and having those vaccine requirements in the next month, in the coming weeks? How long do you think that those will still be in place, and particularly for school kids as well?
Yeah, and I'd love to give you a time, but let me work with the team a little bit to give you a better sense of that. But look at things like this. If you follow the metrics with me, if you follow the case counts, as we get closer towards moderate transmission, means, you know, less than 50 cases per 100,000 per week, we're all going to feel a lot more comfortable. And as the hospitals get less busy, we're all going to be less comfortable. So I'd rather not commit to a time, but commit more to, like, what is the pandemic actually doing in our state a little bit? Because everybody wants to head in the right direction. And I think you're going to see in the coming weeks, we're going to be moving in this. But as we learn more, we'll let you know.
All right, Dr. Jim McDonald, the interim director of the Rhode Island Department of Health. Thank you as always for being with us.
And hope you guys have a good rest of your day.